the Honorable Speaker, Balochistan Assembly, the Honorable Minister for Planning, Varti Chief Secretary, Secretaries, Government of Balochistan, country reps, country directors, consultants, experts, Assalamu alaikum. Ladies and gentlemen, states draw its legitimacy from the provision of services that it provides for the welfare of its people. But the strength of a nation cannot be measured in calmness, rather in crisis. What if mothers are unable to afford food for their children? What if livelihood and employment opportunities vanish? What if millions go beyond or below poverty line like we saw in COVID? The strength of social resilience does not let poor people fall through the cracks of social safety nets, which otherwise can eventuate in social problems and crises and can threaten even the very existence of the states itself. It is the strength of social protection that determines how quickly a nation can rise from the crisis posed by economy or any natural calamity. Balochistan, ladies and gentlemen, under the leadership of current regime, is cognizant of this fact and has focused on health and education amongst other sectors to enhance the provisions of social sector. In my presentation, we will see if it is really the case. In 10 next minutes, we will know what is the situation like, what is the gap, what is being done, what is required to be done, so that we can have a healthy dialogue afterwards with your valuable input. How can I change the slide? Sorry, I'm not a technology guy. Starting from Balochistan, you can see, as said earlier, only 6% of the population of Pakistan is spread over half of the Pakistan, that is Balochistan. And it gives us these barriers of access you can see. Our health coverage is just 20%. In education, we have 2.9 children out of school. And when we talk of the connectivity, to get to the level of Khyber Pakhtunkhwa, we still need 150,000 kilometers of road to get to that level. And apart from this, as said earlier, climate change is playing havoc with us. Our agriculture and agribusiness activities are shrinking, and people are running short of employment and livelihood opportunities. It has triggered urban migration towards cities. And our own source revenue is less, and we are dependent on federal transfers. So these structural challenges leave us with these indicators. Much has already been said about. You can see the Human Development Index is very low. And then you see the human capital, which covers the cognitive and physical abilities, is just 0.34 against the national figure of 0.57. And you can see 60% are multidimensional poor, means 9 million people are living below poverty line out of 14 million. If you further dive in, you can see in health, our immunization is just 50%. As Chief Secretary said, it was just 38% a year ago. In stunting, the figures are very high. And then the maternal mortality, infant mortality, under 5 mortality, the figures are very high. Out-of-pocket expenditure is at 72%, means every single individual is spending 72% of his income. And the protection tools are fragmented that have to be integrated. Then we have shortage of human resource. In case of doctors and nurses, as of now, we need 10,000 nurses. In case of teachers, we will need more teachers because 2.9 children are out of school. Gender parity is not there. When we talk of demography, you can see 70% people are living at rural areas. And we have to get to each and every house. That is very challenging for us. When I talk of education, you can see we have 5 million population of students aging 5 to 16 years, out of which 2.1 are in schools and 2.9 are out of school children. And you can see the breakup below, which is majority is in the rural areas. Then you see the primary health care schools, which are 12,000 in number. But when it comes to middle and high school, the number is very less. It means the pyramid is not balanced. It is a structural flaw. Anyone completing his primary education has no opportunity to join middle school or high school. That has to be balanced. And then you see the facilities that attract students to schools are lacking in many of the institutions. And literacy just 42%, which is high in rural areas in girls. And that is correlated with their health. That is why our maternal mortality is high, our infant mortality is high. And you can see the quality indicators. We are lagging behind the indicators of where we grow in grades. So we need science and math teachers, and we have to increase the quality of education as well. So when this government took over, they had two options. Either do the business as usual and have smooth sailing, or go for reform or revolutionary agenda. So we see and analyze. In health, first we see, based on the 6 blocks of WHO, our strategy was prioritized. We started from the governance and quick fixes. Then we went to decentralization. More than 20 powers have been decentralized from health department to divisions and districts to DHOs, from recruitment to financial and other powers. And then, of course, digitization, because you need to know what is the level of service delivery, and you need to monitor the activities, and you need to take informed decision based on real-time data. And then you can see the PHC strengthening. As I said, 80% is out of the coverage of primary health care. So we have a couple of interventions now to cover that. One example the Chief Secretary gave regarding immunization. And of course, sustainability. If this leadership is not there, the initiative must not deviate. We have a mechanism for that as well. These are the actions you can see in access in governance and human resource. You can see for it because I will not be able to explain each and every one. Does it have any impact? So the first indicator you can see, as Chief Secretary said, our immunization was just 38% for the last 4 or 5 years. And it has moved to 50% in just 1 year. And you can see below that Balochistan is the first province where polio case has not been detected in last 14 months. And this was due to the structural change of taking out all paramedics out of the activities of polio and hiring volunteers, more than 8,000, training them and using them for campaigns, and it has yielded results. So you can see the samples coming down. In terms of essential medicines, in terms of labor rooms, in terms of other indicators, our indicators are, alhamdulillah, improving. Now coming to education, you can see 3,600 schools have been functionalized, which were not functional. And this miracle has happened due to the appointment and recruitment of 12,700 teachers. And the impact of their salary alone is more than 8 billion a year. Now one can imagine, with all the missing facilities that we are giving to those schools for quality enhancement, this miracle has happened. And this year, inshallah, not a single school will remain non-functional in Balochistan. One indicator which is very important I want to mention is the community involvement through PTSMCs, that is parent, teacher, school management committees. And those committees themselves have constructed 6,000 classrooms so far. In case of new and ongoing intervention with partners, we are very thankful to the financial institutions, to the UN agencies, to the governments who are helping us and partnering with us. We have a great program. It is a 100 million loan from the World Bank, which is working on the missing facilities, increasing access, capacity building, and giving scholarships. Then we have Balochistan Education Support Program 2, which is again strengthening the PTSMCs for the engagement of communities as well as capacity building. Then we have Balochistan Students Learning Program, which is working on the dropout prevention mechanism through mentoring of teachers, making them able enough to identify those students and engage them not to leave schools. We are also working on early childhood education. It is the base, and it determines the interest of that child and the interest of that family to continue the education of his child. And of course, there is a research program and EMIS that needs that backing, as I said, real-time monitoring of service delivery at the ground and taking informed decisions. Now, way forward, I'm in my last 2 slides. In health, what we are planning, this is innovative somewhat. Imran Saab is sitting here. We are planning now to give coverage to the primary health care from insurance system. And we have engaged Samin Siddiqui and many others who are the specialists of this sector to devise some mechanism, and we are very close to it. The second is the expansion of nutrition. Much has been said from this morning, and we are now allocating $1.5 billion, and we are hunting matching grant for this, so we will have a $3 billion project. And then we have another approach for that area, which is around 80%, and where we have no facilities at all. So we are going with prefabricated structures installed in those far-flung communities. The one model is for community midwives. The other is for social franchising, like a medical technician coupled with telemedicine and monitoring backup so that we can cover those areas. And of course, sustainability. We have this health information service delivery unit that will put in place all those mechanisms and will sustain it. Once these are there, will not be reversible. The second is that we are pooling human resource and health sector reform unit with the support of Bill Gates. Aga Khan has designed it for us. And of course, the very important is the independent monitoring unit. Apart from the mechanism that we have on ground, we have recruited 85 monitors to be on the field. And from the first week of March, they will start their function. In case of education, you can see we have 5 areas identified. The first is the access. For out-of-school children, $2 billion fund has been created, and the proceeds of that fund will be utilized for the engagement of those children through engagement of private sector. And then we are using our existing facilities for the evening shift as well. Thirdly is scaling up early childhood education already. And then we are engaging communities and private sectors for capitation model, where we'll be paying per head of students and they will be engaged in schools. And of course, then school functionalization through recruitment of further teachers. And then second is on the quality of education, where we are improving core literacy and numeracy skills through different modules of curriculum and modules of teacher training, because whatever you introduce as a module, the teacher has to be trained on that module. The third is upgrading the middle schools. As I said, that there is a equity gap because we have less middle or high schools, so we are now planning to construct more middle and high schools. The last is other interventions. Skill development has been introduced. All the children completing their schools must have skills, so they will be having better livelihood and employment opportunities. Teachers' capacity pedagogy is important, because if teacher knows something but he is unable to communicate to the student, then again we have a problem. And then AI integration, of course, for the services and children learning that is being used, and academic excellence. 4,000 teachers which are from science, technology, engineering, and mathematics are being hired so that we can improve the quality at later grades. Before I close my talk, I have a small concept to share with you, and it is about the nexus of 3 components. The idea is, if someone is healthy, he will be having a good health and will get a good education. If someone is educated, he will be able to keep himself healthy with good hygiene and nutrition. If he is educated and healthy, he will have better opportunities of employment and livelihood. If someone is socially protected, he will be able to either get good health and education. It means this triangle has a nexus. And if one component of this triangle is weakened, the whole triangle becomes unstable. So each component of this triangle reinforces the other. So what we draw as a conclusion is that we have to work in holistic manner. We cannot focus on one aspect of the social protection or social sector resilience. So be partner with the government of Balochistan, as you have always been, and help us tear through this challenge. This is all from my side, ladies and gentlemen. Thank you.